well, let's take case presentation, for
Yes.
example. Okay? So you learn techniques from lecturers that tell you how to move people forward, how to sell dentistry. And your success rate isn't as high as you thought it was going to be. Okay? And the answer to that is because you cannot control other people's thoughts, feelings, or actions.
Okay.
But you can influence them.
Okay.
And that's a key. That is in your circle of influence, but not within your circle of control. And once you begin to realize that you can do certain things that will move people in the direction that they would be better off going in, then you become a leader.
And to some patience developed. Patience, being patient with others, staying with them. That, not saying, oh, well, it's now or never. It's never that way. It's because you're leading them forward. It's when as they're ready.
And you're influencing them. So when they look at you as somebody that they can trust, yeah, you may not get the answer today, but you're going to get it eventually. I mean, if you've been practicing dentistry long enough to know, after 10 years, a patient, the sweetest words a patient can say to you is, whatever you say, Doc, I trust you.
Yeah.
I mean, there's nothing better than that.
Nothing.
Because that means that verifies that whatever I've been doing over the last 10 years has been right. It's been building the trust. Covey calls it building the emotional bank account.
It takes time, though.
It takes time.
It takes time.
It takes time.
So one of the dilemmas, well, I'm getting off track, but we might return to this, or you might speak to it now, is one of the dilemmas I see happening in some dental practices is patients coming in the front door, but going out the back door and not staying. So you don't have that time to develop the trust that does make them the loyal patient, that does want to continue and actually have the dentistry that would benefit them. And this is a dilemma that will always be there. It's a perennial dilemma, but again, there are certain things you can influence to slow down that out the back door.
Yeah. So one of the strongest words in dentistry or medicine is this word that you just mentioned, trust. And so the question becomes, how do you develop trust, especially if you don't have the time? Okay. The silent question that people are always asking is, can I trust you? Even though they don't express it verbally,
oh yes,
they're saying
there.
to you, can I trust you? Can I trust you to put me ahead of yourself? Can I trust you to do the job? Now, what job? Well, if it's simple, two-surface composite resin filling, I guess you can. If it's a full mouth reconstruction case with implants, that's a whole different level.
Totally different.
But they're going to ask that question. They're going to ask that question no matter what they're getting done. Can I trust you to do the job? And so what do you do as this leader to develop that trust? What are some of the things that you could do? Well, number one, first one is don't have a self-focused agenda.
Right. Start with the why, not being the self.
Yeah. It's not you. It's not about you. It never was about you. And by the way, let's go back to trust for a second as a general principle.
Okay.
And you were relating it to time. Two things. Number one, trust is the fastest and most efficient motivator in human existence. So if you're wondering why people aren't saying yes to you, there's no trust.
Got it.
Okay?
Because you're saying there's evidence that demonstrates
it's fast.
It's fast.
Yeah, it's fast. The second thing is with people, fast is slow, and slow is fast.
All right, now I need an explanation.
Okay. With people, fast is slow, and slow is fast. In other words, the faster you go in speaking with people, they're going to take their merry old time in terms of making a decision. Slow. But if you slow down and spend time with people, they'll make their decision faster.
That's wonderful. And that's leadership.
That's leadership.
That's leadership.
And that's what I meant before about autonomy. You know, to be given the time to spend with people to build that level of trust. You see? And when you have somebody standing over you saying you have 15 minutes, no more.
Yeah, that's undermining that.
Yes, of course. And that's a lack of autonomy, and that's it. So of the 5 things to build trust, one was the self-focused agenda's got to go. Number two is drop your judgments. Be non-judgmental. Okay? Now, is that easy? No, it's hard. It's hard. Stop blaming things on people. You'll find that if you do enough interventions in positive psychology, you'll stop blaming things. I remember when I first started, I used to blame everybody. It takes a long time to get rid of that.
I'm
that
sure it
non-judgmental
It's
thing.
sure, it's, 'cause that's also something that happens very easily for human beings.
Sure. You know,
It's
and
part of a self-defense mechanism that's built into us.
I see it on social media all the time. I see dentists saying, "Can you believe what this patient did?" They're blaming.
Yeah.
Drop that. The second thing is validate what people do. These are human beings. They make mistakes like you and I do.
Right.
If they do something that you find a little strange, just validate it.
Yeah.
That's all that counts. That's all they're looking for. You'll correct it later if you need to.
Yeah.
The third thing is, and this is a big one for me, always fall back on reason and rationality.
Okay.
Don't get emotional.
I think this is important as well.
Yeah. It's all about the mind
Mind,
and what's here.
right.
And that's, again, a leadership thing. Don't get caught up in emotions.
This is self-awareness.
Yes, very much so. And self-regulation. That's another one. And the fifth thing about building trust is be generous. Be generous. Be generous with your energy. Go the extra mile. Be generous with your time. Spend time with people. And even be generous with money.
Interesting.
I mean, I had a patient years ago. His name was Lewis. He's since passed. He died about 2 years ago.
I've heard about Lewis before because he
was in his
precious
90s.
too.
Yeah, he was 90s. And
Yeah.
the first time he came in, he told me what he did during his life. He was partners with this guy Herman. I forget Herman's last name, but Herman started a company back in the 50s called the Topps Baseball Trading Company, the bubblegum company.
The bubblegum.
And so he was with them back in the day. He was their accountant,
Interesting.
Lewis. And so we got on, and first things first, he was in his 80s when he came in. He had a great dentition. His wife needed some work. But the point was that week after I met him, I was in a bookstore because I hang out in bookstores a lot. And right there on the new releases table was a book that said The Story of the Honus Wagner Baseball Card.
Interesting.
If anybody knows that story, it's one of the most valuable cards ever. So I said, boy, I bet you Lewis would like this book. I just met him.
Yeah.
I bought the book, wrapped it up, and gave it to him as a gift. That's what generous is. Okay? Am I telling you to do that for every one of your patients? No. But you know, some people that you relate to, you can do that.
You can do that with.
And that's what being generous is all about. You know, Lewis stayed in my practice for years. His wife had dementia. She passed. He continued to come, even when he couldn't drive anymore. He came, and then finally he passed. He was in his late 90s.
Wow.
Yeah. But again, these little things. This is how you build trust.
Not build trust, provide leadership. You have to be self-aware and intentional about yourself, and self-regulating.
Self-regulation.
And I'm gonna end this segment here, and then we're gonna go back into leadership because I've got another great question.
Okay.
Thank you, Barry.
Okay.